Welcome to the Wavy Digital Desk. Today we're going to be talking about the emergency blood shortage. The Red Cross declared an emergency blood shortage just this week. We're going to be speaking about what that means. Riverside Health is going to join us to walk us through this. We have Dr. Munn, Director of Trauma Services at Riverside Health, here with us to discuss what this means. Good morning, and thank you for joining us. As I said, Riverside Health is with us today to talk about what this means in terms of everyday care and trauma services. I'm going to bring Dr. Munn on now to discuss the blood shortage that we're seeing. And I know, Dr. Munn, that they're saying this is the 20-year low for donors from the American Cross. That's the stat they have going right now. But thank you so much for joining us this morning. I guess just to start, how impactful really is this to Riverside Health and to other hospitals I guess, nationally, really?
Absolutely. It is an ongoing shortage that has appeared to have gotten worse than ever before, really. And we always have waxing and waning of the blood supply throughout different times of the year. And for example, the Christmas time frame between Christmas and New Year's, usually there is a little bit of a lag in donations because of people spending time with families and other things. But when we already have an all-time low blood supply, and then we have that kind of change in the donation rate, it really hits us even harder than ever before. And so, it's critically important for a trauma center like Riverside Medical Center, but really at every medical facility across the country, because we are using blood products for all sorts of different purposes, and it's absolutely critical to taking care of patients in all sorts of realms of medicine.
And we've heard, different reports of blood shortages for off and on, I think, for a while now. Right now, they're declaring this an emergency, but this has been something that we've been reporting on, off and on for a few months. I guess particularly when it comes to blood donation, I think the stat is, and I just want to read it because it surprised me, that it's actually maybe about 3 units of blood that people donate when they're giving blood, but for the average car accident victim, and this is a stat from the Red Cross, they say that takes sometimes 100 units of blood if they were to need, trauma services. Is that accurate? Is that about how much that you need? So you would need that many more donors to really be giving, to make an impact?
I wouldn't say that that was the average.
Okay.
But it certainly can reach that high for even one patient. So it's unusual to give that much to one patient, but some people have such severe injuries that, that is the only way to save their life and get them through their injuries. So it's not common to reach 100 for one patient, but we certainly need that kind of supply on the shelf in order to be able to be prepared for an injury like a major motor vehicle collision.
Right, for an emergency. So that perhaps may be more of a staggering statistic just to show, the balance there. I guess to start, just to get back down to basics, you alluded to it there, but can you talk about the reasons blood might be needed, just on an everyday basis?
Absolutely. So it's very common for cancer patients to require frequent transfusions as a part of their treatment. It's also very common for folks with sickle cell anemia and other kinds of blood uh, abnormalities that require frequent transfusions. And that's kind of the constant use of blood products that we have throughout the country. And it's especially critical for pediatric patients, especially patients with cancer and other problems like that, where they require frequent transfusions. So it's, that's kind of the day-to-day part. And then from the emergency services and trauma services standpoint, it really is the thing that saves most of the lives that we are able to save from critical injuries, because we have blood products available and there's really no alternative. So if a patient needs blood, there's nothing else we can give them as a substitute. There's nothing else that can replace it, in the same way that blood products do.
And where are you all getting that blood supply? Are people donating, directly at Riverside? Do you rely on drives? Is that more of a national situation?
Most hospitals do it differently, in various different ways, but really, Riverside, we primarily source from the American Red Cross, which is the biggest supplier across the country. And some major medical centers and teaching hospitals will have their own blood banking, but it's unusual to not have a situation like the American Red Cross where they're doing most of the testing and drives and acquiring the blood products, and then we get those from those sources.
And just for people, who maybe don't understand the process of how you all do get blood donations, is that something where, yes, they're declaring a national, emergency on this, but you all are still, have adequate supply, or is that something that really does impact hospitals nationally?
Well, it definitely makes a difference. We are currently operating with an adequate supply, you know, to the best of our abilities, but we don't have the sort of surge capacity that we would normally have. And so, if that one patient comes in and uses 100 units, that might be our whole supply that we have currently for a patient with that blood type. And so it may be impossible for us to get additional units for the next patient that comes in until a period of time passes and we can get more from the Red Cross, or we work closely with other facilities in the area, and every hospital does this where we source from different locations. We trade blood products back and forth to keep everybody as functional as possible. But really, when the Red Cross has a limited supply, everybody has a limited supply. So we can't make it without the donations.
And in terms of what blood is most needed, there is the universal, but are there any particular blood types where really hospitals are always needing people to donate if they do have particular blood types?
Sure. So, I mean, what I would say is because most Americans probably don't know what their blood type is unless they've donated before. And so I would say that the best thing to do would be, if you've never done it, to go and donate and then find out your blood type, because the Red Cross will reach out to you if you have something that they specifically need. But we really need every blood type. There's really no one who shouldn't donate because they have a common blood type. But if you really look at the things that are the most critical, probably certainly in the trauma world, O negative blood is the sort of universal donor, and that's what we use the most of for a true emergency where we don't have time to do any testing or anything like that. So from the sort of emergency and injury standpoint, that's the most helpful. But we also, have to think about other blood products, and not just giving blood, but giving plasma and platelets is also critically important. And we have had a worldwide platelet shortage for years now. And that has remained critical for quite some time. And so we always need platelet donations, which takes a little bit more time and is even harder to get than just regular blood donations.
And with giving platelets, is that something where you do need to go to more of a medical facility to donate?
It is still organized by the Red Cross, but yes, it's a specific way of doing things, and there's a little bit more to it than just regular blood donation. But still, even just getting regular blood donation is beneficial for all of us.
And I guess I know that you're not in that situation right now, but when you do get in a situation where there is a blood shortage, and I don't know if that's happened at Riverside, but maybe just in general across the nation, is that a situation where hospitals start working together regionally? Is that something where then you all would actually contact the Red Cross who's having the shortage to get more blood? How does that process work?
Well, we have really recent experience with this from during the pandemic. So during the COVID pandemic, we hit a really critical shortage that also impacted our ability to get donations. So it wasn't just that people weren't donating, it was also the processing and the staff that it takes not being able to come to work during the pandemic and get the blood to the hospitals. And so we have better systems in place than ever before to sort of uh, make sure that other hospitals, are able to help each other out, even from different health systems and competing, companies, basically to try to make sure that we do the best things for our patients by maintaining the supply, even if we have to, send blood products to one another. But it all still comes from the Red Cross for the most part, or from whichever blood supplier each individual hospital uses. And, it's everybody is facing the same shortage because it's it's the donation rate right now that is the problem.
And they have opened up some of those donation limitations that previously existed. Did that make a difference, or do you see that making a difference going forward?
I think it picked up a little bit after the pandemic, but it never went back to the rate of donation that we were experiencing before the pandemic. And I think that's what the Red Cross is trying to get across with this 20-year low statistic, because it is, really over the last 20 years, we have used blood products more than ever before, and we were able to keep up with donation rates by, a lot of marketing and kind of getting the word out that we needed those blood products. But I think that having the pandemic really sort of, lowered our donation rate to an all-time low, and it just hasn't recovered back to the pre-pandemic rate. So that's where we are now.
Right, so that's interesting. So you're still seeing really the impact of that time period.
Yes. And I'm sure there's lots of reasons behind why people are not donating. But, right now, we just went through the holiday season where that is a common, drop off in donation rates. And, if you look at the Red Cross website right now, there are donation drives around, blood drives around the area almost every day because we're with empty slots and empty seats that, we really need to fill all of that up to get back to where we're used to being with our blood supply.
So if there are these blood drives, I mean, is it just access to them, or is it people being aware of them? I mean, what do you sort of see, or it could be more complex than that, but what's the factor there, I guess?
I think it's awareness. I think one of the things that happened during the pandemic is that where a lot of folks were used to having blood drives at their place of employment, and they just may have been more common and more commonly acceptable or accessible to the patients. And so now, there just may have been a drop off in some of that, and people are not as aware of the locations where they can go to donate. And it really just takes information campaigns like this where we let people know, because I think people want to donate we make it as convenient for them as possible, and so that's what we need to do, just have as many drives as possible and fill all of the seats.
And I do want to mention, all of this is coming down during National Blood Donor Month. Just coincidentally, we're hearing that news. And it is interesting, as you said, that, the holiday period's a little bit, is always maybe a difficult season for this. So January kicks back up, hopefully, with maybe some increased visibility. But I guess it's really interesting just to see, places of business. Wavy here, we do have, blood drives on site that a truck pulls up. And so we're able to do it that way. But that is interesting, for any companies or people out there listening right now, maybe just to give more access to actually your place of business. So maybe during your lunch break or something as simple as that, you're able to sort of give during that period of time.
Exactly. If you look around on the website, there are lots of locations within driving distance of where we are right now. And many of them are schools or churches or, the colleges in the area. Riverside has one at our health services and, college. And so, there's lots of places, but if you aren't looking for it, you may not know that that was what was going on. And if you didn't attend that church or go to that school, you may not know that they were having it. So it's really just about getting the word out.
Absolutely. And I do know that people do have a fear of needles and do have a fear of blood. And if you have been watching this, I know that on screen there is some B-roll playing that, might also make some people queasy. But, these people are professionals that are available for you there. I think usually they also do have some sort of snack or something afterwards, if you do feel dizzy. I guess what would you say as somebody where you're seeing the need, play out in real life? How important is that maybe to get over the fear, or just try to be as comfortable as possible to donate?
I think it's really important, and I think that the Red Cross does a great job at all of the blood drives. And like you said, they are professionals who make it as easy as possible. It is really generally a very simple procedure to go through, and it's just so helpful that I think that if you haven't done it, it's worth trying. And they will walk you through every minute, every second of the whole process, and it will be way more seamless than most people think.
And then the end result is this really does impact a lot of people's lives at the end of the day.
Absolutely. absolutely critical to everything that we do in modern healthcare. And there's just so many people who suffer if we are not able to get the blood products that they need.
Well, Dr. Munn, thank you so much. And thank you for, also expanding on this to say, platelets and plasma are also, necessary blood products that, people can donate. And that is within, the American Red Cross's, I guess, ability, to help out hospitals here.
Absolutely.
Just going forward, I think the last thing I want to say is that I will link on wavy.com, where you can find maybe blood drives near you or places that are able to maybe be closer to you to donate. So there are ways to find that. But Dr. Mudd, is there anything else on your side that you just want people to know in terms of blood donation?
Well, I think that it's just critical if you've never done it before to do it at least that first time, just so that you can experience it and see, how easy it is. And every unit counts. Every unit is helpful. It doesn't matter what your blood type is. We need all of it. And, we have, I can't think of a time when we've had a surplus where we could really say, oh yeah, we're done. We don't need any extra. So, it's just, it's something that's always going to continue to be a need. And it's a simple thing that everyone can do.
Well, Dr. Munn, thank you so much for spending the morning with us, and thank you everyone for tuning in. There'll be more from this conversation on wavy.com to follow. So again, thank you, Dr. Munn, for joining us.
Pleasure. Thank you.